Good afternoon, everyone. Welcome to the Douglas Laboratories webinar. Today, we'd like to introduce Dr. Peter Bongiornio. He is the co-medical director of InnerSource Natural Health and Acupuncture, which is a thriving practice with 2 clinics in New York City and Long Island. He specializes in mood disorders and depression. Dr. Bongiornio was a postdoctoral fellow at the National Institute of Mental Health's Department of Clinical Neuroendocrinology, and he also researched at Yale in the Department of Pharmacology before training at Bastyr University in naturopathic medicine and acupuncture. Dr. Bongiornio teaches an integrative medicine elective at Mount Sinai School of Medicine and also lectures at the Natural Gourmet Institute in New York City. He is the current president of the New York Association of Naturopathic Physicians and was a major contributor to the textbook of natural medicine and authored the 2010 textbook for physicians, Healing Depression, Integrated Naturopathic and Conventional Therapies for Depression. He is the author of numerous chapters and co-author of many NIH research articles. He authored How Come They're Happy and I'm Not? The Complete Natural Program for Healing Depression for Good, and the recently released Practitioner's Holistic Therapies for Anxiety and Depression. So with that, I would like to also ask you to hold all of your questions for Dr. Bongiornio until the end of the presentation. You can access the chat or the questions box on the right-hand side of your GoToWebinar toolbar. Please submit any question that you have through those 2 places, and we'll get those questions answered by the doctor after the presentation has been given. With that, I'd like to hand it over to Peter.
Hi, thank you. Thank you so much. It's really wonderful to be here. Thank you for your time today. I was going to hit the video button just so I could say hi with the picture. Let's see if that works. Does that work? Oh, there we are. Hi, everybody. Hope you guys are doing well. Welcome to my office in Long Island. This is Huntington, New York. And it is partly cloudy. It's starting to finally warm up. We're finally getting out of the winter, it looks like here. So I'm excited about that. So I'm going to shut the video. I just wanted to say hi. And we'll get started talking about the presentation. Okay, so speaker disclosure, I am a paid medical advisor for Douglas Laboratories and proud of it. So I wanted to talk a little bit in general about mental health. When I think about mental health, I think about really a lot of issues. You know, there are many, many factors that contribute to what we call mental health disorder, whether it's anxiety or depression or obsessive compulsive disorder or other things. You know, generally when we think about these conditions in the conventional model, we really think about neurotransmitters, you know, so here at the top, the neurotransmitters. But basically, there's so many other things that affect this web, you know, starting from the bottom, there's mitochondrial dysfunction, toxicities, nutrient levels, hormones, the epigenetic effect of a lot of things that we, you know, lifestyle and diet and these toxins, community and our stressors with that community, exercise, sleep, digestion, blood sugar, inflammation, foods, and of course our genetics. And all of these things are going to affect neurotransmitters and affect other aspects of physiology that will play a role in why the brain feels the way it does and why the brain sends certain signals that it does. You know, in Chinese medicine, it's kind of interesting. I remember learning probably over 20 years ago now when I was a student of Chinese medicine and acupuncture, that and I was surprised to learn this, that the brain, if any of you know about acupuncture, you know all the organs have a meridian or a pathway, and that you can access the organ via using acupuncture on those meridians or pathways on the body. But the brain has no meridian. There's no brain meridian. You know, there's a liver meridian, a spleen meridian, a stomach meridian, a heart meridian, no brain meridian. And the reason why is because in Chinese medicine, they really thought about the brain not so much as an organ of its own, but really as sort of a relay center and as a station that took a lot of information from the rest of the body. So it's sort of interesting when I think about, what we would consider holistic and integrative medicine for mood disorders, because really when we think about it in those terms, there's a whole lot of things that affect why the brain does what it does or thinks what it thinks or how, gives us the mood that we have. So I think the Chinese really did have it right when they realized that the whole body really affects what goes on in the brain. And then, of course, what happens in the brain affects the whole body. And that's what I like to talk about in my books. And when I give a lecture, I like to start with this slide. And the reason is because I really want to put in context what we're going to talk about. It's very important to have each patient, to give them a good intake, not just the first visit, but every visit. Really try to understand and build upon that understanding of what's happening with each patient, because you never know where that little piece of information that's going to make the biggest differences in reframing a thought or coming up with information you didn't know. So intake is very important at every visit, and to really talk to your patient, get to know them, of course. Whether drugs are important, I think that depends. It's a patient by patient basis. I know many of us in the more integrative world are against medications. And of course, many in the conventional world think it's foolhardy not to use medications. And I think, there's a balance of medications. Most people I see come in on medications, and my general recommendation is, well, don't change anything unless they're having, really difficult side effects. Let's just try to support the body, get it healthy, and get to the place where maybe those medications won't be needed. But there are cases of urgent care where medications can be life-saving too. So I just think, being open-minded to what's best for the patient is always appropriate. Running the proper labs, looking at people's genetics, which we will talk about a little bit later. And then recommendations, making sure they're sleeping, of course, working on their stressors, working on their food, their digestion, blood sugar, inflammation, things we'll be touching on in a bit, exercise. As a naturopathic doctor, I often recommend different kinds of hot and cold hydrotherapies, getting out into nature, doing detoxification if that's appropriate, and then giving people the right supplements and nutrition and things to help them get back into balance a little faster. So for today, we're really focusing on the bottom here. We're focusing on supplements. So what I want to suggest, though, is that the supplements are in addition to all of these other ways of working with somebody integratively and holistically. And I think if we're not doing those things, just using the supplements may not get us really where we need to go and really help the full healing of that person. But I think when you do all of these other things in the recommendations and you include the right supplements, then you can really create the most powerful recommendations possible. Okay, so the first supplement we're going to talk about really works on a few different systems at the same time. Actually, I was giving a lecture in Maryland last year, and I went to the gym in the morning before the beginning of the conference, and I found this switch. There was one switch, and it said mood, and it was from 0 to max. And I figured out it was actually the volume control for the music in the small gym in this hotel I was in. And I thought to myself, wow, isn't that a nice idea? Wouldn't it be great if people just had a little mood button that if they were too high, you can kind of turn them down. If they were too low, you can kind of turn them up. So I took this series of pictures with the switch at different places. And I thought that would be a lot of fun if we could just come up with a mood button for everybody and then just check it when they came in and adjusted it as needed. Unfortunately, there is no mood switch or mood dial. But what we do have are different systems which we can look into and work on and modify to help people's mood change. Working with a hypothalamic pituitary adrenal axis, working with people's blood sugar, working with digestion, working on their brain, of course, and in neurotransmitters and things, and also working with inflammation. When I think about blood sugar, there's a couple of studies now that make it very clear that blood sugar itself will play a very strong role in anxiety symptoms. This second article here, Insulin Resistance in Brain Alters Dopamine, to me that's very interesting. That's actually a study out of Harvard. And what they showed there is they used these insulin receptor knockout mice, meaning that they didn't have insulin receptors. And what they found is that when insulin resistance is high, what happens is there's a great increase in monoamine oxidase enzyme activity, which decreases serotonin, dopamine, and norepinephrine greatly, and probably melatonin, although they didn't talk about that there. And so what we're seeing is that when there's blood sugar dysregulation, which often leads to insulin resistance, even far before people come up with something like diabetes, you're going to see a lot more anxiety and a lot more depression and mood disorders that they might have a proclivity to. Interestingly as well, this study also discussed lowered mitochondrial function too. So, and as we know, when insulin isn't working that well, tryptophan can't get into the brain, which could be a reason why maybe serotonin is also altered. So, so there's definitely a strong relationship there with blood sugar and what happens with mood. This one study from 2008 looks at people with hypoglycemia after lung injury, and what they found was that in the ICU, mean daily minimum glucose is under 100, increased almost really threefold increase of depression, and hypoglycemia of even less than 60 had a 3.6-fold increased risk, so 360% greater risk of having depression. So there is a strong relationship there. When our blood sugar tanks, we get anxious and we get depressed. This was a patient of mine who actually came in originally with multiple sclerosis, but he came in for mood issues, the MS, of course. He had issues with eating. He wasn't eating properly. He was craving a lot of foods, and one of the things we saw when we ran blood work is that his blood sugar was very, very low. So, you know, I know we always worry about when blood sugar is too high, but when people's blood sugar gets very, very low, that's going to induce a lot of issues that will move towards anxiety and depression. And it's good, really, to check insulin on patients like this as well, because many of them you'll find actually fasting insulin is very high. And I know in conventional care, we don't really look at insulin that much, but that's the time to start taking care of blood sugar dysregulation, you know, is before insulin becomes so resistant that then blood sugar starts going up, and then you see the hemoglobin A1C go up. But at that point, you know, it's the horse is kind of out of the gate already, and then you have a lot more work to do to fix that issue. If we can get it earlier, and I think looking at insulin is a good way to do that. Okay, another study here looked at how in diabetic patients, how they found that there's actually a few things that can help this, and chromium is probably one of the best ones, and this comes out of the University of North Carolina at Chapel Hill. And what they saw here was that the floor of the midbrain, where the VTA is, the ventral tegmental area, had changes in dopamine and changes in serotonin with blood sugar and insulin issues. And what they found is that chromium was able to address those things. And what they saw as the ideal patient, and this is a quote from the beginning of the article, chromium has a greater glucoregulatory effect in individuals who have concurrent disturbances in dopamine and serotonin function. So what they found in patients with diabetes is that when they had those disturbances in mood, and they had things like eating behavior, whether it's craving or binging issues, the mood issues, and the blood sugar dysregulation, that chromium was probably best for those types of patients. So chromium does support insulin function. It helps with insulin sensitivity. It moderates the cortisol response. It may influence dopamine as well as the serotonin system. And placebo-controlled trials, chromium with or without biotin seems to help blood glucose as well and mood. So, so chromium is really a nice first choice when you think about many types of mood disorders, especially with blood sugar dysregulation. Chromium dinicosystinate, which is something we use in the formula we're going to talk about, specifically has been shown to be helpful with norepinephrine, dopamine, and serotonin support. It's also helpful for vitamin D, adiponectin, so patients with also issues with weight can benefit from it. And metformin use, it's also been shown to help insulin function as well. So it might be a nice adjunct for people who are using metformin for the specific reason of insulin resistance. And this is just some of the data from Zychrome showing that it does help with insulin function, and it actually helps insulin decrease. And it's good to decrease insulin because insulin does a lot of things in our body. It does put away blood sugar, which is nice, but it also is a proponent of increasing truncal obesity and inflammation, and can also promote atherosclerosis and cancers and things like that. So we need some insulin, but we don't want more insulin than is necessary to get the job done. So it's one of the reasons why when we take in more calories than we need, it's pretty unhealthy for us and will increase the likelihood of all those conditions, including mood disorder. So chromium dinicosystinate, is it better than picolinate? Because most of the studies are on chromium picolinate. But it does seem that the dinicosystinate does seem to have greater effect on protein oxidation, insulin function, and even TNF-alpha. Interestingly, when they were both studied, neither affected A1C, at least in 3 months. So maybe it takes a little bit longer for that to happen. Okay, a second one that I'd like to talk about is called rhodiola. So there's a number of animal studies about rhodiola and looking at the stress response in the hypothalamic pituitary adrenal axis. And it seems like it's very good to help what's going on with the cortisol levels, as well as reducing levels of CFAS. So CFAS is a marker of neuronal activity in the hypothalamic pituitary adrenal axis. So when you're seeing CFAS go down, you're basically seeing the stress response also going down. And these studies looked at rats given rhodiola versus Schisandra. And if you know Chinese herbs, Schisandra chinensis is also a valuable herb for calming the body, calming the Shen, especially when there's liver issues. In Chinese medicine, it's a really good liver herb, as well as herb that calms the mind as well. Okay, so rhodiola, it's good for it's good for the nervous system. It's good for cardio health, energy, mood. It's relaxing. It's even considered neurotropic. There was one pilot study of 10 people, so a pretty small study with a total daily dose of 340 milligrams, which isn't really a high amount over 10 weeks. And they definitely saw significant changes in the rating scales that were looking at mood. Adverse events were generally mild. So, we're seeing pretty good results in the small studies that we're using. Another study of 57 subjects with the same amount of extract also showed, and this was against, they were using it against Zoloft, and what they found after 12 weeks is that both seemed to work just as well, but the rhodiola had less adverse effects. So, so what we're seeing is that we can use a pretty simple herb and get and get good benefits and get less adverse effects. This one study, sorry, it looks like it got a little bit cut off. I apologize for that. But basically what they did here, it was a Swedish study in patients with stress-related fatigue that they looked at. And what they found is that using rhodiola was good for their fatigue, their concentration improved, their mental performance improved. And most interestingly to me in this particular study is they saw a decrease in morning cortisol, and in those people, and these patients that they'll say, yeah, I go to sleep, but I always wake up early. I wake up 3:30, I wake up 4 o'clock, I can't go back to sleep, and it ruins my next day. I'm exhausted the whole day. So rhodiola seems to be perfect for that type of patient who has that fatigue and has that early morning awakening, which I think is one of the hardest things to treat when it comes to sleep disturbance. So we're trying rhodiola. Okay, another one is berberines. So berberine comes from a few different plants. It comes from golden seal, barberry root, Oregon grape, and also coptis. And that's golden seal there on the side. It supports AMK, which is activated protein kinase. That's an enzyme that's important for cellular homeostasis. There's some preclinical, so some animal research which looks at how it probably modulates MAOA, which of course is part of the how things like serotonin or epinephrine get broken down. And something else that's not well talked about is its effect on sigma-1 receptor. And the sigma-1 receptor is important for neurogenesis and neuroplasticity. Unfortunately, I don't know of any trials at this point, big trials anyway, in humans for mood. I think more will be coming. I mean, berberines are one of those things that are really starting to, just robustly come out for so many conditions. For not only gut health, which is, I remember when I was in school, we originally learned about it to help kind of clean out the gut, but also for brain, also for cholesterol, also for insulin sensitivity. So we're starting to see it come up in a lot of places. And I think it's because it's one of those herbs that really can work on very, very basic basic mechanisms in the body's physiology and have a very pleiotropic effect. This one study is what they would consider a PTSD rat model, and they did intraperitoneal injections of berberines, and they found that when they gave the animals the berberines, they had improved behaviors, that they were able to navigate mazes and get into the open fields, which is a sign that the animal's less stressed. And it supported dopamine in the hippocampus as well, and other parts of the brain, and also had relaxing effects. So, so unfortunately, we don't have the clinical trials there. This is a pretty new rat model, and I'm hoping that more clinical trials will follow. Curcumin, probably all of you out there are a little tired of hearing about how amazing and wonderful curcumin is, but it's worth talking about. It's a beautiful antioxidant. It balances inflammation. There's some good studies now about adjusting mood symptoms. It attenuates nitric oxide, so it balances that, lowers oxidative damage, increases glutathione. And one of the things now is that it does help the in terms of the genes SUOX deficiencies, so the sulfite oxidase deficiencies, which can contribute to lowered glutathione as well. When we look at the so there are many, many studies of curcumin. Looking at one meta-analysis that came out last year of 6 clinical trials, almost 400 patients, showed a clinical efficacy when looking at the HAM-D, so looking at patients with depression, significant calming effects as well. So it seems like it's also good for anxiety, and it's safe and it's well tolerated. So curcumin is definitely one of the top tier ones to be thinking about when you're thinking about mood. Saffron has a good study, one good Australian meta-analysis of 6 studies, beneficial effects. And interestingly, saffron seems to also be good for sexual side effects, especially sexual side effects related to antidepressant medication. So it seems to have 2 nice effects there in terms of mood itself, and as for sexual side effects. So the one formula I'd like to discuss that we formulated here at Douglas Labs is a mood balance system, and it has chromium, rhodiola, berberines, optimized curcumin called Longvita, and also saffron. And it's in the doses that individually have the effects we're looking for. So, so it's definitely something I've been seeing good results with in my practice, and I've been getting some nice feedback as well from physicians around the country. It supports blood sugar, it supports the HPA, it supports digestion, it supports the brain. So it's and the reason why I like it is because it's one of those supplements that while I'm still trying to figure the patient out, it's a nice place to start because it just balances overall. It's not really going to overtly change anything, change neurotransmitters. It's just very, very supportive. Whether it's more of an anxiousness, whether it's more of a depression. And as far as I know and what I've seen, really no issue in terms of being concerned with medications people are taking, because it really it doesn't have the same effects the way the medications would. So it seems to play nice. This is just one customer that had, I guess, put something up on Amazon that wasn't at all asked for. And this is from a doc. I guess heard one of my workshops, went to a workshop held by a naturopathic doctor. What he taught was backed up with research. So I tried some. There was a short time the product was available. So I knew I wanted to keep my daily supplements because without it, I have to work harder to keep positive. So this is somebody who's talking about using it for himself. And I also like that it assists with sexual functioning related to saffron. So, someone else said I experienced a death in my family. After spending a few years as a caregiver while I was accepting this person, was finally relieved of suffering. The death hit me much harder. The product has been a huge help for my functioning at the level I needed in order to wrap up the life and paperwork of my loved one. So in addition, I felt motivated to begin walking again for 2 to 4 miles a day. I believe it helped cultivate a desire to take care of myself now. So that's certainly an N of 1. It's certainly, we need more studies and we need more proof. But like I said, I've been getting some really positive feedback, and I'm happy that it seems that that this formula seems to be a good support and really fills a need for many patients. Okay, I wanted to just discuss a little bit about depression. We're going to change gears a little bit now and talk about antidepressants. Now, when you think about antidepressants overall, and this is from the National Institutes of Health, basically what they suggest is that that antidepressants, so people who don't take antidepressants, about 20, but took placebo, about 20 to 40 people see improvement. Okay, now this is moderate to severe depression. When given an antidepressant, about 40 to 60 people out of 100 seem to see improvement. So you get about 20 out of 100 people will get some more improvement using a medication than without. So it's not a great percentage when you think about it. Of course, if somebody is in an urgent care situation, they're a danger to themselves or they're a danger to someone else, sometimes that's warranted. But the great number of prescriptions given are given really for mild to moderate depression. So I think, we should be thinking about, what are other choices that we have out there that can hopefully, support a person in such a way and not have to rely on medications that may or may not work anyway. So, so this study looks at assessing the comparative effectiveness of antidepressant therapies. And what it suggests is that that the antidepressant drugs overall seem to be more effective in what you call non-melancholic depression, meaning the kind of depression that when people aren't deeply, deeply depressed, maybe there's an anxiety/depression going on, and that the newer drugs in specifically seem to not really work well at all for that severe type of depression, that severe type of melancholia. So that some of the older drugs seem to be the best overall. So when you look at this this work from 2015, what we're seeing is that the tricyclic antidepressant medications, the TCAs like amitriptyline and imipramine and things like that, seem to work a bit better than the SSRIs overall. When you think about the tricyclic antidepressant medications, they work by elevating a few neurotransmitters. So not just one, but a few of them. They work on increasing serotonin, they increase norepinephrine, dopamine. So the that's right, that's what I was going to say. And then, but the problem with that is, so they do seem to have a good efficacy, better than the SSRIs, but the downside is that they also seem to have a lot of side effects. And in fact, it's well known in psychiatry that you really don't want to use tricyclics with the elderly population because of its anticholinergic effect, as well as it also has an antihistaminic effect, and it can increase sedation, constipation, contribute to urine difficulty. So you have an elderly person who already has some urine issues that can make it worse, dry mouth, tachycardia, low blood pressure, things like that. So as people get older, those things actually become a little bit more dangerous. So, so even though the tricyclics seem to be the best out of all of them, especially for the melancholic depression, it's not a great choice, especially as we age. So I just wanted to talk about some supplements that are supportive of those pathways as well, and talk about another product that we use to support those pathways. One of them is tyrosine. So tyrosine, obviously, probably you've all heard about it. It's a good catecholamine precursor. To tell you the truth, there's no studies that I've found that using tyrosine by itself seems to support a really beneficial effect in depression. There's this one study versus imipirine, and the tyrosine at 100 milligrams per kilogram per day, which is a pretty reasonable dose, didn't seem to really have great effects. So that's one thing. I do know that there's other studies that look at tyrosine in kids with like things like attention deficit, where the norepinephrine is probably pretty low and dopamine's low, and they do give tyrosine and they do see effects. So I'm wondering if tyrosine may have somewhat of an effect, but it's not enough for people with depression who maybe have other issues going on as well. So, because sometimes when I think about attention deficit and things like that, I think it is on the continuum in some ways with depression, in the sense that it's usually people who have lowered levels of neurotransmitters. And maybe the tyrosine might be enough to traverse that for people with attention deficit, but might not be enough because depression is a few more factors and maybe neurotransmitters than just the ones we mentioned. So in the supplement, we're going to talk about neurotransmitter balance. We also have mucuna. So mucuna is probably best known as an anti-Parkinson Ayurvedic herb. It does contain L-dopa alkaloids and a touch of 5-HT as well. So, and there's studies in animals that looked at forced swimming tests, and we saw a decrease in mobility time, which means that the animals, it's sort of a way to see that they were doing better and that they had more motivation to keep going. One study in 75 normal healthy fertile men and 75 men undergoing infertility screening showed that giving mucuna actually supports testosterone, luteinizing hormone, growth hormone, dopamine, epinephrine, and norepinephrine, as well as reducing FSH and prolactin. So it does seem to have a very positive effect on the hormonal system as a overall, and the neurotransmitters, by seeming like gently raising them. So with mucuna, it is an herb that has L-dopa in it, and I don't think it's an herb to be used lightly, and I would be careful using it in very high dosages, because like giving L-dopamine, I think sometimes when you give a lot of L-dopamine, then we could start to have other concerns as well. So I think, but what I've learned is in smaller dosages, in combination with other supplements, it can be very, very helpful to help people feel better. Another well-known herb, so there's really only two natural supplements that even the American Psychiatric Association has deemed appropriate and effective at treating anxiety and depression. One is St. John's wort, and the other one is SAMe. So SAMe is a very strong supporter of the methylation pathway. Here's just a nice crude drawing I did of that pathway, and if you look at the very right there of the methylation cycle, SAMe hooks in right there. It takes methionine to make homocysteine, and of course relies on the folic acid cycle as well. And that the folic acid cycle turns the biopterin cycle, right, the BH4 cycle, to help the amino acids turn into the neurotransmitters. So SAMe is an important part of that process. And SAMe is an important supporter of mood. One randomized controlled trial, double-blinded, almost 200 patients given 12 weeks of SAMe at a pretty high dose versus SSRI, showed that, and basically what they did was if at 6 weeks they didn't see any benefit, then they gave people even more. So that's why there's a range there. And they found pretty good response rates for either the drug or for the SAMe. And lower for the placebo. If you notice, the placebo isn't that much lower than either the SAMe or the medications, which tell us that, whether it's a drug or whether it's a supplement, that even though we are getting significant benefits, the significant benefits aren't that fantastic, which is why I showed you the original graph about really the effect of antidepressants. So whether it's an antidepressant or whether it's a supplement, by themselves, I don't think we're going to be, fully healing these mental health conditions, which is why, again, we don't want to just do these things as a monotherapy, but we want to do these supplements in addition to other modalities that help people with sleep and get them exercising and get them eating well. So okay, so results fail to support an advantage over placebo for either investigational treatment, SAMI, or the standard treatment. So what we're seeing here is that, yes, these things have an effect, but it's not an unbelievable effect. If you look at a meta-analysis, you will see that SAMI wasn't much different than placebo as well, and established antidepressants. So what all these studies are telling us is that we do get a little bit of a helpful effect from the drugs, and we do get a little bit of a helpful effect from the supplements, but by themselves, not phenomenal, which is, again, why we need to do things in a very holistic fashion. But again, having said that, I see patients that when we do a good protocol, integrated protocol, and we give them things like this, that it can really help them get out of, how they're feeling and feel better. So 5-HTP, 60 patients times 8 weeks. So this is a study from 2001. And they were seeing pretty good results there, certainly better than placebo for the 5-HTP. 5-HTP comes from tryptophan, which comes from our protein and supports the production of serotonin, and then serotonin into melatonin. So whether it's people who are anxious or have low mood or sleeping issues, it can be very helpful. There's some mouse data that suggests that adjunct 5-HTP time release can also be a support for that too, and that 5-HTP is effectively absorbed by the upper intestine, and that's according to some mice studies. So we are seeing that this supplement does get absorbed and can work. We also know that, I remember even in school when learning about 5-HTP many years ago, I remember learning that they said, oh, you should always eat it with a cracker or a slice of apple or something. Well, now we know that that when you raise insulin a little bit, that it has an effect, right, on how 5-HTP is used. So that's why when there's insulin resistance, you're going to get less of an effect of 5-HTP. One last herb I wanted to talk about was called apocynon, which is a Chinese herb that's been used for 2 or 3 millennia. It has a lot of flavonoids in it. Some people think it's like St. John's wort, and I think in terms of its final effects on mood, that's probably true in a general sense, but there's no hypericin and there's no hyperiform in it like St. John's wort has, which is a benefit because one of the things I was thinking about when formulating is we don't really want to add St. John's wort to the formula, because then so many people who are on drugs probably wouldn't be able to take it because of the effects that St. John's wort has on the CYP enzymes and can change the effects of many other drugs. So this particular herb does have significant mood health effects, which is attributed to how it can help increase norepinephrine and dopamine as well as serotonin. Some studies and from China give GABA along with the apocynon for more relaxing and calming effects too. So again, like some of the other things we talked about in animal studies, it reduces the mobility time. It supports how dopamine is made in the hippocampus, and it can also modulate dopamine receptors too, at least according to some mice studies. So there's a few things there that are, it kind of works in slightly different ways in the brain to help support dopamine and norepinephrine overall. So it doesn't seem like it's just one mechanism, but a few small ones there. So then the supplement we're talking about is a neurotransmitter balance, which I formulated about a year or two ago. This one has tyrosine in it, it has mucuna, it has SAMI, it has 5-HTP, and it has venetrin. So, and when I think about using this, I think about, patients who have low mood, people of non-urgent situations, who have low mood. I've also used it with patients who have, attention concerns as well, for people who have, just that low motivation, maybe sometimes difficult to focus. If there's a strong anxiety picture with it as well, I might add something like GABA. That can be very useful. Douglas has a 500 milligram GABA, which is very helpful and can be easily added to that program. One review said, I tried neurotransmitter balance from Douglas after being recommended by a clinical therapist. I wanted to try something natural. I've taken 5-HTP on its own without noticeable change. After a little less than 2 weeks of taking neurotransmitter balance, I felt significantly lighter, less fatigued. I recently ran out and the effect was noticeable. And that's about right. Usually within a week or two, I start to see benefits for patients when I prescribe it to them. So, and it says, I'll be making sure I don't run out in the future. So that's one thing. It's nice that they said that, but what I recommend for my patients is really working on all the basics, sleep and diet and lifestyle and the right foods and getting out and exercise and doing all the things that will naturally keep your neurotransmitters up in the long term, making sure the gut is very healthy, lowering inflammation, because we want to get people to a place where, whether it's a drug or a supplement, we want to get them to the place where they feel like they don't need anything to stay feeling good. I mean, it's great, to have the support when they need it, but we want to get them to the place where they just feel healthy on their own, So that's really the long-term plan. So again, just to break it down really quickly, to support the neurotransmitters, norepinephrine, dopamine, serotonin. So there's all of those there. Okay, and just one other from a doc out in Washington State. Just lots of good feedback from the product overall. I take it and I give it to lots of patients with low serotonin and low dopamine. I find that it works much better than, and she mentioned another popular product. So that was really nice. So thank you for that, Dr. Wada. And let's see. So I just wanted to mention really quickly about genetics in terms of the neurotransmitter balance. So when I think about the production of neurotransmitters, if you look at that pink cycle there, the biopterin cycle, we're seeing how tryptophan and tyrosine are being converted into things like serotonin, dopamine, and melatonin, norepinephrine. For many patients, if you look at their genetics and their MAOA and their COMT are running very fast and kind of hot, they're burning through a lot of these neurotransmitters. And as a result, their neurotransmitters are actually getting pretty low regularly. So I think a support like neurotransmitter balance can be very, very good for those people. So as I'm learning more about genetics, I'm putting these pieces together. What I'm realizing is that, we can look at the genetics and start to get a sense of, okay, who would do better with what supplements? It's still a lot to learn, but, little by little, we're getting there. And similarly, we talked about earlier that sulfide oxidase enzyme at the bottom right there, which helps turn into sulfate. When that system, the CBS and the SWOX system, isn't doing all that well, then things like glutathione aren't going to be as beneficial. And we talked earlier about there are supplements in the mood systems balance that can be useful for that as well. So we're starting to piece this together. I think we have a long way to go. Of course, we know about folic acid and homocysteine. But it's really fascinating, and as we learn more, I think we can get more and more specific on how we can help patients using these natural supplements. So in conclusion, I just wanted to say that, as I said before, that it's really a holistic plan. We want to really get to know the patient, decide, where drugs really play a role here if we need them, look at the right labs, look at the right genetics, look at people's genetics, and then start looking at at what the right recommendations are. Good sleep, working on their stressors, food, digestion, blood sugar, inflammation, exercise, hydrotherapy, getting into nature, detoxing when necessary, and then giving them the right supplements, which we talked about today. And I think the supplements we talked about today can be very, very helpful in addressing a lot of those underlying issues. So what did Hippocrates do many years ago? The father of medicine, he recommended healthy food, good sunlight, getting out to exercise, water therapy, and herbs. So in a way, I don't really have much more to add to that. I have some more specifics because people are doing research, and luckily I get to read that research and put those ideas together. But the basic idea really comes from Hippocrates in terms of how to help people, really heal and get healthy. So again, and I'm happy to take some questions at the end. We'll have some time. So think about when you're working with patients, with these challenges, to consider mood systems balance, to consider neurotransmitter balance. Also, I have my information at the end there, and I would be happy, if you want to send me an email, you have a question, you want to talk about it. I'll probably be creating more webinars and things as well. So let me know if you want to learn more about those as they come up. Also, Douglas Labs has a new clinical strength EPA fish oil. Fish oil, as you know, is just it's one of the top places to start. Our brain is made of fats and water, and when we get good essential fats in, we're going to build a better brain. And there's tons of studies looking at fish oil being helpful for mood. It's not a short-term, it's a long-term commitment, to get the right oils in, but they really make a big difference in the brain. In fact, now there's even good studies showing how fish oil adjunctively to antidepressant medications will also help the antidepressants work even better. So there's so many reasons to use fish oil. I didn't know if Carla, if you wanted to mention anything about that as well.
Oh, okay, sure. Yeah, the clinical strength EPA is another Quell product in the line, and the dose is a 900 milligram soft gel. So it's a 1-serving singular tilapia fish capsule with the 900 milligrams of EPA concentrate in the capsule. So as we, evolve, I think the capsule size is getting smaller, and it's getting more convenient for people who are wishing to supplement with fish oils. So it's very concentrated, and it's supporting the neurophospholipids and that modulation of the dopaminergic and the serotonergic pathways. As you can see on the slide here, there are a number of different benefits that we see that are becoming more prevalent with EPA as research goes on. So the first one being that low levels of EPA in the blood and tissue may affect mood balance. The higher EPA intake and plasma levels are associated with positive mood and emotional well-being, and that omega-3 fatty acids are shown to be supportive for healthy blood lipid levels and biomarkers as well. So this is coming soon. They will be available to order on the Douglas Lab website after tomorrow. So stay tuned, and if you're interested, you can take a look on the website or order through a representative of Atrium. So Peter, I have a few questions that came in. Is it okay to ask them now?
Yeah, absolutely. Be happy to.
Okay. So the first one is, what would the dosage and timing of mood systems balance for sleep duration issues in early awakening be?
Mm-hmm. Well, I would probably start with one in the morning with food, and then one in the evening, either with or without food.
Okay, with or without.
Yeah, I think with or without food is fine. People have different ideas. The reason I'm saying possibly without is because I think the saffron and the curcumin might be better absorbed away from the food. And I like that evening dose because it should support that early awakening. If that doesn't work as well, then you might even want to try 2 in the evening.
Okay. The next question, was it said that the 2 Douglas products could be taken in tandem with SSRIs?
Well, so every case is different, right? So generally, I would say the mood systems balance, I'm pretty comfortable recommending it, for people who are taking medications. Because really there's nothing that's going to be very competitive or work very similarly with the medications in terms of mechanisms. The neurotransmitter balance, it can raise things like dopamine and serotonin and norepinephrine, which is helpful and can be used with medications, but you have to be careful. The same way sometimes they use augmentative therapy with certain medications. A practitioner can bring this in. But it's something that if they're taking medication, my strong recommendation is start slowly and monitor. I do use it in tandem with medications, but I'm also very careful. What my one recommendation would be: don't use it with patients who have a history of bipolar disorder, or manic behavior, or schizophrenia, or any kind of psychotic issues where raising things might be problematic. So the vast majority of patients with low mood, it's low mood, but that would be the only caveat that I would just be concerned with.
Okay, great. There's another question from one of our participants. What would you recommend for OCD?
Yeah, OCD. So the OCD, I would recommend the mood systems balance. Generally, I often recommend extra tryptophan as well. Douglas has a wonderful tryptophan complex that has some of the B vitamins that come with it. And I find that using that along with N-acetylcysteine can be very, very helpful. So those would be the three I would think about. And of course, going over all the basics. I have had occasions as well where I've added lithium orotate to that mix, and I found that helped too. So those are the ones from the supplement world that I've seen useful, along with, of course, blood sugar regulation is vitally, vitally important in obsessive compulsive disorder. So definitely working on their meal frequency, meal timings is going to be helpful as well.
Okay, that's interesting. And one last question. This is coming from Patricia, and it's asking, what neurotransmitter testing do you use?
Right. Well, I don't think there's amazing neurotransmitter testing in general. The one I've been using that I really like is it's from a company called Dutch. They do a Dutch lab, and it's actually an adrenal. It's a urine test. It's a dried urine test that looks at adrenals. It also looks at some organic acid, and it also looks at metabolites in the urine for neurotransmitters. And I tell you, I'm starting to see some good correlations and results with that. And I've probably been using that for about a year now. So that's probably my favorite at the moment. I'll tell you the truth. I didn't talk about it in this lecture, but many times, when people tell you they respond well to a medication, that can give you a sense of what neurotransmitters are low. Like if people do really well with, for example, an SSRI, then wow, serotonin must have been low because you kicked it up and they felt so much better. Unfortunately, as we talked about in the lecture, we don't often know because they only work 20 to 30% of the time, right? So in the majority of cases, it's not just a neurotransmitter issue, which is one of the points in my first slide. So that's why I think sometimes neurotransmitters, looking at those and really relying them solely may not get us to where we need to go. Because when I think about it, even when they are off, they're usually off because of a whole bunch of other issues, which is really what we want to work on. But I do like that one test. I think it's been the most useful that I've seen so far.
Excellent. Thank you for all those great answers, and thank you to the people who are asking them. At this time, we do not have any more questions, so I'd like to thank Dr. Bongiornio for all of this great information. You have your contact information up on the slides, and we will also have this recording available on the Douglas Laboratories website. If you do have an account with Douglas Laboratories, you'll be able to access this training and this webinar at your convenience for future playback. So with that, everyone, please have a great Thursday night, and we look forward to talking to you soon in additional webinars. Thank you.
Thank you so much.
Thanks, Peter. Goodbye.